Okay, let's do this. We're gonna call the August 25th Board of Health meeting to order. Mark Norrell's coming, but he said it's gonna be late. First thing, is there a public comment? Yeah, is Michelle there today? Is that who's there? Hello?
Hello.
Any public comment? Hearing none, we'll move on. If anybody comes up looking, we can have them join us later. We need approval of the July 14th meeting minutes. Anybody have any comments or changes? I know that Mark sent a few grammatical changes in, which
Yes.
we got taken care of. Anything, anybody else have any changes or
I don't, okay.
additions?
I didn't find any
I didn't
further
find any.
changes.
Okay,
I'll move that we accept the minutes
okay, Steve
as received.
has moved. I need a second.
Second.
George seconds. Okay, we need to. Now, since we have people on Zoom, we need to do a roll call, right? We'll just do it anyway.
Steve?
For approval of minutes, Steve?
Yes.
Yes, George?
Yes.
Okay,
Yes.
Bob? Yes, okay. And I also say yes. Okay, so the minutes are accepted as written with the changes. Our first report is from IU. Is Graham here or Chuck? I see Graham up there. Could you put Graham on? Hello? I know Graham. Are we elevating Graham? Aha, there he is.
He's muted.
Hey, everybody. Can you hear me?
Thank you, Graham. Good to see you.
Good to see you as well. Thanks for having me. Happy to give an update from IU. As you all know, we're at the start of the semester, and with that, I've seen a bit of an uptick in COVID. Not really surprising, as we just kind of passed the peak of BA5 nationally. And now we're getting everyone back together again, and certainly they are back if you've been outside of your house or door. And we tend to have our largest numbers of the week on Mondays, and that's held true this week. And we've seen successively lower cases throughout the week, and I think that will hold today as well. And if I can say historically, with COVID, we seem to kind of peak out at the start of the semester in week 2 or 3. So we kind of expect that same pattern as well. And kind of where we are right now in regards to COVID-19, we did align with newer CDC guidance related to exposure and isolation. And we are still providing and offering testing. Folks could get antigen tests on campus, or we have drop-off PCR testing, saliva-based PCR test kits in our vending machines. And folks can use those for any style, whether that's symptomatic, asymptomatic, travel related, or whatever. We did reopen those labs on August 8th. We want to continue to promote that because we'd like to see more samples being run, and it is available to any IU constituent. Most testing appears to be symptomatic based on the positivity rates, which are generally higher, and I'd say about in line with the national average right now.
What is the positivity rate you're having right now?
I'd say closer. I think the last check around 15%, which is about the national rate. And again, I think we've had such low numbers of tests through our new labs since we've reopened, and so I hope to see more of that as well. But a lower rate would be nice. So we're still asking folks to self-report their positivity if they used an antigen test or a non-IU saliva test. And we still have required vaccination or exemption reporting for all faculty, students, and staff, as we have in previous years. And we've modified our case investigation and contact tracing a bit as things have evolved. So starting over the summer, we still have the ability to view cases by faculty, students, staff, department, residence hall, Greek house. And so we could still identify a lot of potential clusters and those kind of things. And we still meet every morning at 9 a.m. to review cases and talk all things COVID or chief health officer related. And our incident management team for COVID is also meeting every Monday, Wednesday, Friday to discuss related matters. But contact tracing is, I don't know if we can call it that, essentially automated at this point. It's a form that folks fill out after they report their diagnosis or after their IU positive test is reported. And they can give us some details about their exposure. They can list the number of IU-related close contacts that they have. And if they report a high number of close contacts, or if there's something that's getting our attention through our other surveillance, we will reach out to those folks to get more information. We are asking people to notify their own close contacts, and we provide them a link with our guidance for those that are exposed. We still have isolation facilities in IU Bloomington. This year in Redbud Apartments, we have 50 rooms designated for isolation, and so far have ample space available there. And we are still offering high filtration masks on campus and encouraging the use of the best mask possible if folks are wearing them. And so really focusing kind of on harm reduction and trying to limit disruptions this semester. If we are able to get updated vaccines, it sounds like they're coming very quickly, which is great news with the bivalent Moderna and Pfizer shots. We hope to have those available and ideally right along concurrently with our influenza clinics this fall. And we can provide an update and would love to help promote that if that happens. Also just want to lend our support generally for potential partnership for wastewater surveillance. I know we're working with our School of Public Health researcher, as well as other entities, including the county. And we think having that in place is going to be incredibly helpful in our ability to manage and monitor community diseases going forward. In terms of monkeypox, to our knowledge, no known or suspected cases at IU Bloomington. Doing a lot of preparation, education, outreach, and developing internal guidance, whether that's public health guidance, cleaning guidance, isolation guidance. Very happy that Positive Link is offering walk-in vaccination at Pride and has vaccination available here. That's awesome. And we want to promote that and get that to our high-risk groups early in the semester to help avoid any cases or clusters. We are also working with IUPUI and Marion County Health Department. We're going to have a pop-up clinic on campus at Indianapolis in September and October. And I believe Positive Link was on campus today for some education at our some of our student organizations. And really happy to also hear that IU Health will start in-house testing for monkeypox on Monday. Excellent news, and we'll have the ability to funnel samples there with that shorter turnaround time. But happy to answer any questions as well. Thanks.
That was very thorough. Thank you. Anybody have any questions?
No. Pretty much covered everything.
Yeah, that's great. Look forward to see you next time too.
Well, thank you. Hope to be there.
Ready. Thanks a lot, Graham. Okay. Next, we have the Public Health Clinic. We have Sally here, right? Yeah, there's Sally. I see Sally. Hi, Sally. Thanks for joining us. Are you frozen or just muted or what?
I'm just trying to unmute. Can you hear me?
Okay, there we go. Great.
So highlights from the Public Health Clinic include that we continue our homebound COVID vaccination program on an as-needed basis, but the demand has dropped off in the last couple of months. We still are going out as requested, but it's only been a couple times in the past 2 months. COVID vaccinations for all ages continue to be given in the clinic, and those are mostly boosters and for children. Back to school vaccinations, we're planning, we have already done a back to school Saturday clinic that was done July 9th, and we had a good turnout for that. Reminder cards for vaccinations were sent out to parents in July by both the State Department of Health and the Public Health Clinic. Expanded vaccination hours in the clinic have been offered and currently are offered. We recently added Mondays until 6 p.m. to give parents time to get their kids here after school, and then one Saturday morning per month. Home COVID tests are being distributed upon request to community health agencies, programs, and facilities, as well as to clinic clients and other individuals. So far, 7,414 tests have been given out, with over 2,700 remaining. A new generator is now in place in the clinic for our vaccine refrigerator and freezer for backup. That protects our expensive vaccine from spoilage due to power failure. So we've been working on that for a long time. Actually, we wanted it for years, so we're really happy we finally got that in place to protect our vaccine. We have a nurse available on Fridays now for monkeypox needs if any questions or concerns or cases come up. We have had fewer than 5 monkeypox cases confirmed in Monroe County to date. And we do have systems set up coordinating with Positive Link to handle cases and testing as needed and vaccination of case contacts if needed. Positive Link is vaccinating some at-risk clients, as you know, with monkeypox vaccine pre-exposure. And as I said, the county health clinic or public health clinic is able to vaccinate confirmed case close contacts. And we are pre-positioned with the vaccine for that purpose. We're awaiting arrival of our flu vaccinations or flu vaccine. Those are due to arrive any day, and we'll offer flu vaccinations to all ages and payer sources as always. So if anyone asks, yes, we do have the high dose. We will get that. Sometimes we're the only place in town people can find it. We have upcoming school clinics planned for flu, COVID, and other catch-up vaccinations. We usually do about 21 or 22 of those, so that will keep us busy, combined with all the other things we're doing. Wellness and COVID vaccination outreaches, as far as recent and upcoming. We have quite an extensive schedule. We're doing lots and lots of outreaches. We have 11 more planned until the end of the year, so in the next 3 months. We did 7 in the past 3 months. And these, of course, include outreaches to underserved and at-risk populations. Some we have a low response and some we have a good response. It varies. As far as tuberculosis, we have under 5 latent TB cases in treatment through the clinic right now, plus under 5 LTBI cases in process, and no TB disease cases. So we have no active TB cases in Monroe County at this time. Lead case management and medical guidelines changed statewide on July 1st. And that allowed services to be provided by a Monroe County Public Health Clinic case manager and the county risk assessor at a lower lead level threshold than previously. So currently we have under 5 confirmed lead cases, but they are rolling in a little more frequently because that threshold has lowered. And we anticipate a steady flow of lead cases. That's about all I had. Anybody have any questions for me?
I do. Are you having any problem with supplies for monkeypox vaccine?
We have ordered supplies, I know, and there was a question going around about whether we're supposed to be getting those through the health department or not. So I haven't heard the outcome of that discussion. That was just this morning. So I think they were going to be checking with Christina about whether they can get supplies. I think the State Department of Health told us they're not providing supplies, but to reach out to our preparedness coordinator.
Yeah, I know other areas have trouble getting the vaccine.
Oh, you mean vaccine? No, we
vaccine.
have vaccine. We're just looking at testing supplies and things like that. We have some, but we were hoping to stock up a little bit. So those were the supplies I was talking about. We do have vaccine pre-positioned here.
Okay, so you can meet the demand at this point. That's good.
At this point, we're good. Mm-hmm.
Yeah. And what have you heard about the bivalent COVID vaccine for this fall?
That's what I was gonna ask.
Just that it's not ready and they haven't officially approved it to send to us yet.
Yeah.
So we're expecting probably, I mean, I would guess in the next couple of weeks, we'll hear more.
Yeah.
And hopefully we can combine that with our flu clinics.
I'm hoping if it,
We'll
Yeah.
definitely get it and they'll definitely be offered here.
okay. I'm just hoping that, that the demand is there for it once you get it. So,
Yeah, we hear a lot. We're getting refusals quite often too when people come in for regular vaccinations and we offer a COVID booster. We get a lot of people saying, "No, I'm done with that," even though they're due for a booster. So some people are just over it. We'll just have to see. We always have that percentage of uptake from people that are eager. Usually the older folks are eager to get the newest vaccine, but
okay, sounds good. What are the questions you all have for Sally? All right. Oh, well, thank you, Sally. Appreciate you being here. See you next time.
thank
See you
you.
next time. Thank you. Okay, the next thing on our agenda is the population health and outreach, and Kathy's Hewitt's going to do that. Is that right? There we go.
Yeah. Good evening, everybody. Yes, I'm going to give an update for population health and outreach, and I was going to start with the community health assessment and community health improvement plan. Now, I have a very brief PowerPoint to show you, and this is actually a presentation that we've been giving it around the community, the health department, Parks and Rec, Community Voices for Health, and IU Health Bloomington. So this will give you a brief background about the assessment and what has started with our CHIP. So, okay, the Monroe County Community Health Assessment has been a collaborative effort of the partners I just told you about. Okay. So what we have been working on for the last probably year and a half is the community health assessment, and it is a systemic process that involves the community to identify. Pardon me?
I was trying to see if you could make that bigger because it's really too small for us to.
Yeah, we
read.
can't see
I'm
it.
trying.
You can't read it?
Try, okay, thank you. Oh, now it's smaller.
Hold
Okay.
on. I don't know, because it's on full screen for me in here.
What does it look like for you guys?
Too small to read most of the print.
Yeah, I wonder if it's,
Oh,
There.
hey, okay.
I got it. I got it, I think.
Thank
you can
Is
see
Is that
better.
better? Okay,
You've been too big.
Yeah.
Yeah.
You're down just a touch.
all right. A community health assessment is a systemic process that involves the community to identify, analyze, and prioritize issues that affect the community health. And over the last couple of years, partners for the community health assessment have gathered health data and perspectives of hundreds of community members to better understand local health conditions and priority issues. This assessment will serve as a guiding document for the community health improvement plan that we are starting to work on. Next slide. So what is the process of community health assessment? So this slide shows the whole process that we've gone through. And the beginning is always planning on what we need to do, and trying to map out all the steps so that we don't leave anything out. So this whole process involved a significant amount of that planning and coordination among the 4 lead members. It included a community survey that was made available online and at the vaccine clinics hosted by the health department and IU Health. We hosted many focus groups and deliberative discussions to gain a better understanding of all the health issues that face the county. In addition, we collected community health data from various government and nonprofit sources to increase our understanding of how the conditions in Monroe County compared to other communities of the state and the nation. We analyzed health data and the residents' input and determined 10 top priority issues that affect the county. We held think tanks meetings in April and May to share the community health assessment, information, and data about the 10 priorities. And after discussion about each topic, the assessment information and data. We voted to select the top priorities to focus on for the community health assessment or CHIP. Next slide. Okay, these were the top 10 issues that were chosen from looking at the data, the community input, and the survey and the focus groups. So, okay, at the CHIP, we gave all the data. We had other discussion groups, even at the think tank, and these were the final issues that were selected by everybody by voting on the issues they wanted to work on in the community health improvement plan. So you've got poverty and navigating health and social services, inequity, discrimination and bias, and substance use and mental health. There was actually a fourth issue that was chosen as well, and that was homelessness. But we also already have a large coalition that is headed up by United Way and the community foundations that are working on that right now. So we held our CHIP kickoff on July 14th, and we held it at the Fountain Square Ballroom. We are very thankful for Cook for letting us hold it there with such a beautiful room. So 2 of the CHIP groups have already started meeting. That's the substance use mental health group and the poverty and navigating health and social services. The 3rd group will meet Friday tomorrow at the Monroe County Library. So CHIP groups will meet regularly as a time that are chosen by each group. We do hope to have large group meetings with everybody from all 3 groups together at least 3 times a year. And if you'd like any information, or if anybody would like information about the CHIP groups, you can go to the Monroe County Health Department webpage on the Monroe County website and look under the Monroe County Health Assessment and Improvement Plan tab. So you can find meeting times there, as well as the things that the groups are working on. Okay, and since I already had a PowerPoint, I thought I'd throw the other updates on a slide too. So from our harm reduction program, we have an overdose awareness day that we are partnering with several other organizations on, and that is next Wednesday from 6 to 8. And then on Friday, on September 2nd, we've got Paint the Town Purple, National Celebrate Recovery Month event. And that is from 5:30 to 7:30. So we hope everybody who's interested can come to both. Try to wear purple if you come to the Celebrate Recovery, Paint the Town Purple. And that's just a great day to celebrate recovery. Our harm reduction staff attended an event at IU campus last week, the Sex, Drugs, and Rock and Roll. It was a very busy event, and they talked to at least 300 people and trained 31 people to actually distribute Narcan at that event. And they also are continuing their regular HIV and Hep C testing. They visited 3 shelters within the last month, Kinzer Flats, Shalom, and Crawford. So they're keeping that busy as well, and also partnering with the DIS to visit the shelters and make sure people have access to care. So next slide. For our tobacco program in the Population Health Division, so working with the Monroe County Tobacco Coalition, and the goal of the coalition in 2022 is to build support to add vaping to the Monroe County Smoke-Free Ordinance. And if you recall, we worked on this in 2016. So we're looking to go back and revisit that. Shauna is working on doing research and updating our e-cigarette brief so we can have all that material ready to go. We're also working to continue to look at what the program might look like after we end with the Baby and Me Tobacco Free program. So we're building that program together and coming up with ideas and continuing to look for grants to support the new programming. Okay, that's all I have for you. I'll take questions if anybody has any.
Thanks, Kathy. That's good. So in terms of the trying to get the ordinance for adding vaping to, I mean, our biggest block has been convincing the commissioners to buy into it. How's that working? Or how are you approaching that?
Well, I think the first thing to do is to update the research and build the research. So that's our first step, and then we can talk to them. So and we see how they feel about it.
Is there anything that we need to do in terms of when was it, 3 years ago?
2016. Yeah, it was a while ago.
when we, we last approached them long ago, we had an ordinance that we suggested, right?
Right, we still have that, so we can look at that. I was definitely going to reach out with you and talk to you, because I know this is one of, a thing you're very interested in. So,
Yeah, so the question is, legal need to look at it again and see if we need to change anything at this point, if it needs to be updated, because it's been a while since. Maybe that's something we could talk about the next meeting.
Yeah,
Can we
certainly,
do that next meeting?
certainly
for you?
the last time this came up, we testified in front of the city council.
Yeah,
Yeah.
the county commissioners. I believe. And they just basically said no. But, yeah,
Well,
But there's been a change in the commission.
it's very small change.
right, and
it's a
5 years
key
later,
change.
we should have our data, so.
Yeah, so that'd be great. So, yeah, let's talk about that next time and see what the best approach to that would be and timing wise and all that.
Okay.
Be great. Thanks, Kathy. Anybody have any other questions for Kathy about the chip or anything else?
Well, nice job.
Thank you.
Thank you. Thanks for coming. Appreciate it. And now, next is administration, which is our fearless leader, Lori.
Yes. Okay, so we have had some staffing updates. Alyssa Mundy joined us in the temporary environmental health specialist position. She's going to be cross-trained in both foods and septic wastewater. Emily was the former COVID-19 school liaison. She is now back part-time with the public health emergency preparedness as the assistant. And Marshall Allen has started as the clinical assistant with Futures Family Planning Clinic.
So do we have a different school liaison now?
Joe is our school
Okay.
liaison. Yes. So we are fully staffed. We don't have anything vacant at this time.
That's nice.
Yes.
For a change.
Yes. Let's see. With public health preparedness, we do have a monkeypox information page on our website. We have also had a call tree for the hotline to now include monkeypox and COVID. There has been outreach to the homeless facilities in the area regarding planning for monkeypox and cleaning protocols. We have also shared information with all of the local emergency departments on the process that they should use for notifying if they are releasing homeless individuals who have been tested for monkeypox. The public health office, there was mold in the storage room that has been cleaned. They're going to be retesting that, I believe Friday. It appeared, it really looked a lot better when I looked at it the other day. So,
That's like downstairs, right?
yes.
Yeah.
So our school liaison has been distributing COVID test kits to daycares, YMCAs, government agencies throughout the community. We have around 3,000 left. Kendra is going to be distributing tests at the airport event this Saturday, and Joe, the school liaison. So they're going to have a table there to hand out brochures and COVID test. Updates for the school grant. The project was able to pay for a full-time health aide. The St. Charles School was able to install desks for the classes instead of queues. And schools were able to install water bottle refilling stations and obtain disinfection products.
Lori, do we have any way of knowing how much COVID is in the schools right now since they've started?
I don't think they have to report it anymore, do they?
Well, they do if they have been if they reach the 20% threshold. So I believe we've had 3 that have reached that threshold since school started. Yes, we have had 3 outbreaks in 3 different schools.
Are they older kids or younger kids or what?
That I would have to ask Joe. I think it's been a mixture.
Okay. You don't have the names of the schools there, do you?
All within MCCSC. We've just been following the general CDC guidelines and recommendations. That's what we've been providing to all the schools when they reach out to us. Alyssa Delgado in environmental health. She continues to work on wastewater administrative tasks, training and field inspections. She's going to start cross-training in foods mid-August. And then Alyssa Mundy is going to be cross-training and working part of her hours in the wastewater section. So those are the two big changes within the environmental section. In addition, Jessica is now the senior EHS, so she's officially in that position. And I was able to meet with Sally from HealthNet. She is working on a list of the different things that they have been working on.
What's her position there? Sally?
Sally, I believe she's the manager.
I don't remember Sally, but
Shelley's the lead. not
Oh, Shelley, yes.
Shelley, yeah.
Shelley.
Okay, all right. That makes more sense.
I ought to know that because people do that to me.
Yeah.
So, yes.
Okay,
Yeah, I know Shelley really well.
And they are also helping with the monkeypox outreach. So that's been great. Other than that, really the only other thing I had Kendra include this packet on the grant management software. This is something that I've been in discussion with the council liaison, have submitted to the commissioners and to legal about the potential for obtaining some type of software system for the department to use and potentially share with other departments in the county.
yeah, I think the department has some things that are updated technically and some that just aren't. That's a good thing to try to get things up and.
So, yeah, you can, the good thing with this, it's the cloud system. We could have multiple users. So again, different departments could access and use this as well. And then costs could be split within the other departments. And then just tracking deliverables and having all of the information in one platform is something we are exploring.
That's good.
I have one additional question back to the
Yes.
Shelley from HealthNet. What exactly is our collaboration with HealthNet? What kind of information are you, it says list together of what they've been working on.
Prenatal,
Oh, because of our support for that program, okay.
yes,
That's good.
yes.
I don't think, we don't give them any other support, right?
No.
I don't think so.
But it's just that what we've been working on, I
Yeah.
thought, is there something else? You know, it's just that.
No,
I still have trouble with their names since they changed.
Yeah.
Right.
From
It's
volunteers
kind
and
of a
others.
generic name. It's hard for me to
Yeah,
bring to mind whenever I try to.
okay,
Carol, can I ask a question?
sure.
I feel like odd man out. Everyone is wearing a mask. And in the last meeting, I was the only one wearing a mask. Is there something that I don't know? Is there some reason why you're specifically wearing masks that?
Well, Kay and I decided that we probably should, since we're both immune suppressed.
Well, hand me a
George
mask.
George is just old.
And I didn't have one when I
And
came in.
and Steve, so Steve put it on because we had
Right.
one on and Lori wears them
See?
anyway, so.
You need to tell me, like say it too.
Yeah, so, yeah, we just, Kay and I have been feeling vulnerable lately. So, again, rates have gone up in the community and, it's just,
But
Yeah,
that
I'm
was,
more than happy.
that was probably actually the other thing.
yeah.
Yeah,
The
Rates are slowly going.
They are,
up,
and so I think that,
it's fine.
earlier this summer, the rates
I
were really
remember.
low, not much happened,
You know, and I am particularly feeling a little bit vulnerable too, because this is really the beginning of school, and I have not been maskless in the classroom for 2 years. Well,
Yeah,
since,
exactly.
right, I hadn't been in the classroom without a mask for ages.
None of the students are.
No,
Yeah.
but, you know,
But yeah, it is. It's
this is the
hard,
test.
it's hard to re-enter society as we used to know it.
It's anxiety provoking.
It is, it is. Yeah, my son's a math professor at Ivy Tech, and he's the same thing. He's just now re-entering the classroom because he's been doing everything virtually.
Yeah.
And it's like, so he's spending like 16 hours a week on campus, which he hasn't done for 2 years. And
Yeah, in a way, I'm more comfortable wearing a mask now.
well, there we go. We're all good. Sounds good. Any other questions for Lori?
I have something.
Yes.
Remember, and this was before you came on board, Lori.
Okay.
We had a group that talked to us about studying the health of the water at Lake Monroe.
Yes.
Yes.
And they said they would keep us informed about what that study showed. Have we ever heard
Well,
anything from them?
we issued a letter of support.
Yeah,
for
we
the-
should let
did.
support, and
We
they're
did.
having a conference in October. And
Okay,
people
okay.
from the department are actually going to attend. Yeah, because they did contact and what I said, they asked us to talk to us. I do want to talk to them, but since they're having this conference in October, I thought it'd be more appropriate to wait till they have that conference and have them come back and talk to us. But yes, they are coming.
Super, super.
Yes.
That's all I wanted to know.
Yes, that has been addressed, but we put it off because of that conference.
Okay. Just wondered what happened.
It's still out there,
Okay.
as it should be. Okay,
Oh, we have someone, Maggie is with the group, actually. Online, she said if you have questions.
so I think, I don't have any specific questions right
Okay.
now. I do think we want to update, but I think we want to update when they've
After the conference.
just after that, I think we, yeah, so probably, I'm not sure when the conference is.
Unless you had something particular of really good information to impart right now.
Right.
But you could probably wait till after the
Yeah, I
conference,
think so. And then the
Well, there's
timing will be
Maggie now.
depending on when that conference is in October, so I don't know exactly
And
when
the
that
board
is, so we'll figure it out. It'll be the next meeting or the meeting after that.
There is Maggie.
Hi, Maggie.
Hi, I don't want to take up time. You guys seem like you have a full agenda, but we do want to come and tell you about the watershed management plan. It's complete. The big issues that we're looking at are sediment, nutrients, and E. coli. We'd love to talk to you more about the E. coli issue and where septic systems might tie into that. And as she said, we're having a watershed summit October 22nd, where we're bringing together leaders from Brown County, Monroe County, and Jackson County to talk about these issues and where there might be some potential for collaboration.
Okay, we look forward to hearing about that and also having you come give us a more updated, more complete update so I think our board meeting in October is before your meeting, I believe.
Yes.
So the one after that, whenever we figure out when that is.
Yeah.
That we'll definitely put you on the agenda then, look forward to it.
Sounds great. Thank you.
Thank you. Any questions specifically for Maggie right now, since we have her? Yep. Okay, thank you. All right. Any other old business anybody wants to bring up? We talked about the smoking ordinance and, okay. Code review. Here we are.
Do you want me to share them on the screen as you go through them?
Yes, please. I think we have copies here to share. We can share. So we're doing 310 first, okay. Health Department service fees. Who's talking right now? Is it Ashley?
Hi all, I can talk. It was originally supposed to be Kathy Hertz, but she might be busy, so I can go ahead and start.
Okay.
If you have questions about the birth updates, I don't know that I can answer those. Those would have to go to Kathy, but I will start with other things. On your first page here, it's mostly just changing that food service establishment to retail food establishment. That's our current language for that. So that's a pretty simple change there. Kendra, if you want to go ahead. Thank you. And then the only thing on this page was, and again, this might be better served for Kathy Hertz, was talking about dropping the wallet size
Right.
until they run out of basically their supplies for that wallet size set.
Yeah, yeah, she had a good description in the stuff she sent us
Yes,
earlier.
there are appendices that kind of address each change with reasoning and rationale, but happy to answer questions too. The futures, we just changed the name to the official name of Futures Family Planning Clinic. Just some language change there in the middle. And then we kind of go into foods. So the big proposals we've made in the food fees are, first of all, when we talk about seasonal establishments, we've had a 4 to 9 month establishment, seasonal establishment, and then a less than 4 month seasonal establishment. Currently, all of the farmers markets run longer than 4 months. So we are talking about dropping that 4 month or less. Because none of the markets do that. They're all at least 5 months long, I believe. And then we've proposed doing a multi-market license. So we're proposing $100 for one market. And then instead of, if you want to do a 2 markets, instead of charging that full $200, we're proposing $175 and then $250 for 3 markets. So that's the change there. The next one is the $50 re-inspection fee. So currently when we do a pre-operational inspection, the fee we charge covers a plan review and 1 inspection, 1 pre-operational inspection before opening. But sometimes some restaurants, whether there's carelessness or other issues, we need to re-inspect before they're able to open. And so that's why we propose adding that fee. It just takes time away from other restaurants and things. The home birth fee down there, I know Kathy did a lot of the work on that, Kathy Hertz. I know it requires a lot of extra work, and that's why they proposed the fee there. If you have questions about that, I'm not the best person to ask, but I'm sure
She had a
Kathy.
she had a good explanation of stuff that was sent out earlier, so.
Yes.
She had the hours documented and everything, so.
Yes, and then I know you'll see this strikeout on the late fees here, that we've just moved to the bottom of the document. For some reason, it's kind of randomly placed in the middle here, so that's the change on this page.
Okay, yeah,
It's down there. And then we've also proposed removing the real estate septic inspections, and you have a whole page on that too in your packet, I believe. But I'm happy to answer any questions, and I know legal is here as well, so yeah.
yeah, this looked pretty straightforward to me. I didn't have any issues. Do you guys have any issues?
No.
No, it was nice to have everything to read through beforehand. It was great, made this go a lot faster. So
So we need a motion to approve
I have
310.
a motion to approve these from Steve. I need a second.
Second.
Okay, we'll have KB second this time. Okay, so we'll vote to accept these as presented. Steve,
Aye.
George,
Yes.
Kay,
Yes.
Mark,
Yes.
Bob. Where'd Bob go? There's Bob.
Yes.
And I say yes too, so that passes written. What's next? What are we doing next?
The next is our private sewage disposal system code. I realize there might be questions on this. So we've had to strike out a lot of our code due to the new House Enrolled Act from the state. We've added this language at the beginning that we follow state code and the new House Enrolled Act, and that, we're following our fee code. Other than that, we've tried to retain what we can, and that's pretty minimal, I think.
There we go. Okay, so we get to about, get way down there before we strike all that stuff.
7, I believe. There's approved installers. At this point, I think we can keep that. It's about our, basically our installers here in the county and what
Right.
we're requiring of them. At this point, we believe we can keep that. And then on the next page is Well, I'm sorry, it's a little further down.
Lots more stuff to strike out.
Yes, a lot.
Yeah. Then we get to
Basically,
A.
part Q that we kept on page 10. I'm sorry for all the scrolling, Kendra. It's about having building and planning department support. We're trying to keep that, maintain that as well. And then lastly, at the very end, it's basically our violations and penalties.
So one of the things, we gotta look at the fees too, in addition to the codes. There's none of it. I did not see any fees associated, a fees page for this.
This isn't, as far as private sewage disposal systems. There is some of it in 310.
310.
310-4, the one we just did. We didn't have changes to it. We maintained those costs for now.
I don't think
You
we,
want these?
oh, so that's the, so in there, okay.
Mhm.
Yeah, so, not that I want to jack up fees, but, because I really don't, but one of the things that we were concerned about in the past was that, we didn't review fees, it's like once a decade or something, then we had to like make them go way high.
Mhm.
And I think that, you know, that's something that we wanted to look at on a regular basis to make sure there aren't some things that are using more personnel time than we thought. I saw that the one change on the home burst, that was well documented. Have y'all looked at the fees on the other stuff too, or is that just maybe next time?
Yeah, with the dropping of the real estate septic inspections, that was our priority this year. But I do know the goal moving forward is to review this every other year, if not more frequently. So that's something
Right.
we can definitely jump on the next time around.
Okay, let's just make sure we address that some next time, because I know this has been hard with everything with COVID. We're just trying to just get back on track right now, so
Yeah.
I truly understand why we don't do
And
it right now.
Ryan is in the chat. He's the lead in the wastewater section. And I know he's proposing in the future to add a flat rate fee for $150 across the board. It's something we need to review. You know, I know we've talked about it in the past with the administrator, and don't know that flat rate is the right way to go, just because, you know, a new install is different than a repair and things like that. But it's definitely points we've been discussing, and we can definitely revisit.
Yeah, I don't have one of those things. I don't have any real issues or something specific like something like that where it comes up before we review again, where it's just completely out of whack. If I don't mind reviewing a small section of it at any time, do you? You know? No, we don't mind doing that. So even before the next 2 years comes up,
Okay.
if there's something that comes up that we clearly need to act on, we don't have any problem
The
doing it.
lawyer agreed every 2 years was a good general
Right.
rule.
Right, we just kind of missed that because of everything went on with COVID, but
Right.
yeah, and we all understand that. So,
So are we proposing then maybe we review this in 1 year rather than 2, since we didn't really look at fees?
how do you feel with that, Ash? Would that work for you?
We can, if you know, if
Because
it's
it's been-
something you
it's
want us to
actually
do
been-
now, that's, you know, something we can do too. I know when we first talked about it, there was concern that, you know, changing too much at once. And that's
Right.
kind of why we surpassed that for this year. But if you want us to revisit it now or next year, we can do that.
Why don't we give you some time to breathe, and why don't we do it next year?
Yeah,
How does that sound? That
rather
sound
than
good to
waiting
everybody?
2
Yeah.
years, because we've already gone
It's
past.
been like 4 years or
Yeah,
something at this
yeah.
point, so
Right.
maybe next year would work, and yeah, but
And
we'll
then-
give you some time
And
to.
then get up back on the new 2-year
Yeah.
schedule after next year.
But if something comes up, like a small change in the meantime, we don't mind looking at that either.
Okay.
Great, thank you. So
Is there
what,
anything else about the chapter 365?
then that's. I don't think so. We didn't vote on this yet, did we? So we need to accept the changes as proposed, correct?
I so moved.
And I need a second, and Steve seconds, so George and Steve. We need to vote on favor accepting it as, with the changes as proposed. Steve,
Yes.
George,
Yes.
Kay,
Yes.
Mark,
Yes.
Bob. Bob still there? Hello, Bob.
Yes, I'm here.
Okay, there you are. Okay, and I also vote yes, so it passes unanimously. Okay, did we do it all?
Yes.
Okay, good. There's lots of paper here, so, okay. So now we have Mark. You're gonna talk about the Governor's Public Health Commission. I believe there's PowerPoint slides, which I reviewed already, which are good.
Right.
So if we get those up,
It's a
so we
long
can see them.
It is a very long, I'm going to take a very short amount of time. I've got the highlights for you.
Yes, I actually read the whole thing.
Yeah, I did too.
Yeah,
And there's a lot in it.
There
I
is a
think
lot in
it's easy to summarize though.
Yeah,
So,
I could summarize it in a couple. things. We aren't spending enough money.
so
but
as soon
I
as
was
we're,
just spent most of my time on the kids stuff.
My computer went
so while
crazy with
she's
it.
calling that
Where's
up,
the
I'll just
CA
preface this by saying that I am not an insider in this process. I know this came up in either our last meeting or the meeting before, that where is the commission in their work? And the commission submitted their recommendations to the governor on August 1st. I happened to see that that was submitted, so I took a look at it and thought that it might help us to hear about the highlights. So if I can take just maybe 6 minutes
I appreciate it.
and
That's great.
cue it up.
Is it not showing for you? It's showing on mine.
Black. We see
Okay,
black.
hold on, let me reshare it and see. Okay, is it there now?
We have a black screen.
Maybe scroll.
Oh, hang on. I think I needed to change the fit. Can
Oh,
you do it again?
yeah, let me go back to it.
There we go.
Is it there?
Yes.
Okay,
Let me make
Yeah,
it.
maybe just need to scroll it up or something.
There we go.
Ah,
Okay.
yeah, now maximize if you can. Is that as,
I think we did 100 last time because 150
150.
took it off the page. We can-
Yeah, that goes
Yeah,
off the
that's
page
good.
if you
We
did
can
more,
read
is a
it.
problem. Yeah,
all right, 100?
like
Yes.
100 it is.
Yeah.
Okay.
All right, so the governor's office commissioned this Public Health Commission a year ago. And it was perceived to be a good time to be doing that because we were getting a handle on COVID, I think, at least at the state level, they felt, and in the governor's office, they felt that we were getting a handle on COVID, but that there was lots of opportunity to learn, lessons learned, to look at those lessons learned. And that caused the governor to appoint this commission and ask for recommendations on how we can change our public health system in Indiana. So that was nice. I guess from our perspective, it's always good to be introspective about processes, and particularly at the state level. I know we've, had the, what was it called here that we did locally, the debrief that was called, very, very extensive debrief that we talked in the last meeting that we did here. You remember?
That one?
Like it- Yeah. The after
Action report improvement
All right.
plan.
So anyway, this is kind of along the same lines, looking at a broader perspective. Good, stay there. A broader perspective rather than just on pandemics, but what can we do at the state level to improve public health in Indiana? And so there's the charge. I'm not going to read that, but essentially that's what the governor's charge was to the commission a year ago. The commission completed its work, submitted their report on August 1st. Next slide. This is the commission. It was headed by two co-chairs, Luke Kinley, who was a former state senator, and Judith Monroe, a former state health commissioner, and other important people, none of which I know except for Dr. Halverson up at IUPUI. Next. An interesting slide that they had in their report compares Indiana on overall quality of life in Indiana to other states. And Indiana ranks 32nd out of 50 states, or 50 to 52, depending on how they measure it. So we're in the middle of the road when it comes to quality of life. But next to it is health rankings. Public health metrics put us 40th out of 50 in the state, in the nation. So that sets the stage and shows us that there's much room for improvement. Okay, next. The commission decided to establish working groups in these categories. And these categories were headed by staff at the state level that led these different work streams, they call them, and provided research to help the work stream groups in their work. And they divided up the work into emergency preparedness, public health funding, governance, infrastructure and services, workforce, data and information integration, and child and adolescent health. Next. And this is how the report was structured when it was turned into the governor. It was structured following those work streams. So I'll just briefly highlight the main things from each work stream. First, on governance, infrastructure, and services. And I should have worn my glasses.
Can I hold it farther?
No,
away
no.
for you?
Maybe Kay could hold.
I can hold it over here if that would help.
All right, so to allow restructuring of county health departments and for the governance to allow, let's see, to allow for, I know that it's okay. I can just talk, I can talk for a minute. We have to indicate our partisan affiliation when we get appointed to the board. We have to indicate whether we're Republican or Democrat. Those are your two choices, Republican or Democrat. Now, on our website, or at least it used to appear, that there's two people on this board that never declared a political affiliation. So our political affiliation is blank, right? So I don't know if that's in line with current statutes, but we're supposed to declare either Republican or Democrat.
We're supposed to have a balance. We're just
Right.
challenging in
I
Birmingham.
know when I was put on the board, and they told me it was due to one of the criteria was my political affiliation, so they had looked up voting kinds of things. So it was known
Right.
when we were put on the
It
board.
was.
They may just not have typed it in.
Sure. Well, the recommendation is to put into statute that independents are allowed on local boards. All right. So we're already behaving that way. So there's not any real insinuation, not any real change as far as the current composition. But it's no more than two independent. The rest have to be partisan one way or the other. For counties like us, under 200,000, if the recommendations are taken by the governor and the statutes are changed, we will have one member appointed by the executive of the most populous city in the county. So that would mean that the city of Bloomington will have one seat available to be appointed on our board. And another seat, another member appointed by the county council that represents the general public. So the county council of Monroe County would appoint one member of our board. Okay, next slide.
Right now, though, just by the commissioners, right?
Just the commissioners.
Yeah, so I thought.
The commission is their authority. What's this? The commission is recommending to the governor that statutes allow the creation of multi-county health local, quote, local health entities. So we could create one health entity for surrounding counties if we so wanted, if the governor followed this recommendation.
So there already are districts, right? We already have health districts.
District,
Where-
I think so.
Yeah. So that's different than that.
That would be circumscribed by counties rather than some arbitrary district
The districts are just a cluster of counties right now.
Well, I don't think a district follows county lines. It follows,
Is that right?
I think it follows,
Arbitrary,
it can follow a census tract or a city, right? So,
I have no idea what our districts follow, frankly.
yeah, and I believe that to be the case. So that this would specifically say that you can combine resources, right? Combine resources and have one executive and have one department of wastewater for 4 counties, right? And we have discussed this from time to time about providing services. You know, we had a septic inspector that went around to other counties and provided that, you know?
It'd be good, it could be good, particularly for smaller counties.
Right. But, you know, I don't know about Lawrence County, but at one point in time, I met the head of Lawrence County Health Department. And I think she was indicating to me that basically she was it for Lawrence County. She did not have very much of a staff. You know, it was basically just a health nurse in Lawrence County.
Yeah,
Right,
a lot of
so-
the counties like that around, like that around
So
here.
hang on to that thought, right? I mean, you know, this is maybe a long range. I don't even want to say a proposal. It's not even that. It's just a capability that, or something that could be enabled.
That would require changes in some of the laws. and
It's
stuff.
an option.
It's an option.
Yeah.
Next. Expand personnel that are eligible to serve as local health officer. So this would allow a nurse practitioner or a physician assistant to be the health officer. The health officer could be a nurse practitioner or a mid-level. Now, that individual would have to have a supervising physician, just like they would in clinical practice. There would have to be a collaborative practice agreement. And it seemed to me that these recommendations insinuated that the state level would have a physician available to supervise local nurse practitioners or physician's assistants that would be the health officer for that local agency. Right, so that's a pretty big change. I'm gonna editorialize. I wish they would expand the scope of practice in the state for nurse practitioners and PAs a bit to provide more access to care for, you know, particularly primary care is just a real problem. My goodness gracious. And I know there's politics behind it. And I know the State Medical Society is vociferously opposed to it, as they are in all states. Maybe some rural states have relaxed that a bit because they have such an access problem that they need to do that. But if you look at how long it takes to, if you're a new person in Monroe County and you want to get in to see a primary care physician. be
You know, we
prepared-
probably shouldn't talk about that.
Yeah.
Just because the politics are just so
Yeah, no, no.
difficult right now.
Okay, that-
It's
and
a
that's
very
off topic.
political thing, and
It's off topic.
there's some very good reasons why all the family practitioners and people are leaving.
Yes, sir. Okay,
Yeah.
no, we'll leave it at that.
So
Okay.
we should just leave it at that.
All right. Okay, anyway, so that's, I think, this particular recommendation that kind of fleshes out the conditions under which that could be allowed. Makes recommendations in that line. Financial and technical assistance to local health departments. So provide technical assistance to local health departments pursuing accreditation, right? So that's technical assistance, and that's fine, but the next bullet is to provide funding
Oh,
to
yeah,
defray
that.
the
Funding.
cost. Yeah, oh, yeah.
Yeah, funding.
Oh, good thought, okay.
Oh.
So, and then consider incentives to get local health departments to move towards accreditation. So we're down the track, well down the track on that. As maybe not the first in the state, but a state leader towards accreditation, but maybe some assistance on an ongoing basis financially would be appreciated if that comes to fruition. Next slide. Public health funding proposes to bring the per capita public health expenditure in Indiana from the current $55 a person up to $91. Right, and that's, that does not even take us up to the average of the rest of the country. They just want to get partially there. So this is good.
And even the national average is well below what's recommended, so.
And yes, right. So this is a recommendation that people on the commission have. They certainly are interested in seeing more funding flow. So we'll see what happens politically when it gets to the budgeting, budget request from the governor's office and what our legislature is likely to do with regard to funding. They're also saying, gee, shouldn't we benchmark those per capita expenditures on an annual basis to inflation? Just tie it to the rate of inflation. I don't know what kind of inflation measure they're looking at, but rather than just say, this is the funding level and it never changes from year to year to year, let's automate the process of receiving increases over time. Next slide, please. This is the work stream on emergency preparedness. So the commission would like to see increased utilization of the computer tool called EM Resource, which is a emergency preparedness shared data system that is shared among hospitals, public health departments, first responders, and other government agencies that do things like resources in the event of like PPE, ventilators, things like that. Where are they? How many do we have? Let's keep track of it. So there's, and I don't know the current status of our health department's utilization of this EM tool, EM Resource, but it looks like they want to suggest that funding be increased so that local health departments can use it.
Doesn't emergency management at the county level deal with that sort of stuff?
I
The
don't,
Department of Emergency Management may tie into the fire department and.
right, like
and
incident
health.
command, but this is more targeted to pandemic infectious disease type
So
of things.
it's medical as opposed to
Right.
physical disasters.
Yeah, I assume that EM, the M probably stands for medical. So it's probably, and I don't know, George, but it's probably more specifically targeted to medical incidents. And then the next recommendation is to require local health departments to have a PHEP coordinator, which we just talked about today. We have that. I assume that's at least half time,
She's full-time.
full time. All right, so that's something that is suggested and we already comply. Next slide. And the last work stream is child and adolescent health. And there's a number of recommendations here that I would characterize as kind of future, not so much specific not specific actions, but in general, what it does is it focuses on improving child and adolescent health through the schools. Like it tends to, it looked to me like the commission sees the school systems as the principal way to reach children and adolescents. And most of the recommendations were focused on schools.
Yeah, that's been discussed for decades. And the general population doesn't seem to want to accept that.
Well, but
Seriously.
again, that gets
Yeah.
political.
Yeah, again, yeah.
That gets political, but that's a challenge when it comes to certain populations is how do you reach that population? And doesn't it seem?
Since they all go to school, it seems like a good place, yeah.
Doesn't it seem like a logical
It does, doesn't it?
place to focus?
It
And
does.
some of the most at-risk populations are constantly moving. So that they're not under the supervision of a single school nurse or a record-keeping system.
Right.
So it's
Mobile society.
fraught.
Yes.
Indeed.
aspirational, not realistic.
Yeah, there was a, which schools, I think it was the Templeton, where they have a 50% turnover every year.
Oh, my goodness.
Yeah, 50% turnover in students through the school year. That's,
And they're trying to hire school nurses right now. That's a real problem. when
yeah, I
it's
mean, not all
one
the schools
nurse-
even have a school nurse,
Yeah,
Exactly.
one nurse per 750 students
which
is
is,
what they're wanting.
not even close to what's happening in Illinois here, so. Because they don't pay school nurses enough to get them to, yeah, so.
So I think the commission is basically said, here you go, our work is done, so.
Yeah, so yeah, and I read through it, a lot of it requires funding. And, that's a decision that has to come from someplace.
And I'm not connected enough to know,
The legislature is where the funding has to come.
sure, of course, and,
Yeah.
and who knows, maybe commissions are appointed all the time that make recommendations and they just
I've been on some of those commissions.
have you.
Yeah.
But, if a pandemic can't get a legislature's attention, then I don't know what can.
Tell me about it. Yeah, I've been on various commissions because I was president of the Indiana chapter of North County Pediatrics
Yeah.
for a while, and I was on lots of stuff then, and you make recommendations and nothing really happens. So,
Well, as dismal as 40th on public health funding sounds, at one time, we were like almost at the very bottom. We were like
Yeah.
47th for a number of
You're
years.
competing with Mississippi.
Yes,
Yeah,
so
well, actually,
40 sounds.
40 is pretty
by
good,
7
yeah.
points, But it still is bad,
Yeah.
and the legislature
We're
has to
getting
come
better,
across
yeah.
with money,
yeah,
and,
And that's a shame because Indiana has a solid sort of manufacturing and business base. I mean,
We just
Indiana's
returned
an
$1 billion
economic powerhouse.
to people. you know.
maybe
Yeah,
instead of
that's
giving it back to me, could we like do something with it, yeah,
And
Yeah,
you have a
because
state budget
some of it-
surplus.
yeah.
You're Giving
Yeah,
money
no,
back
thank you
to
for the
the
$400, by the
taxpayers.
way,
The
state.
one the one thing that Indiana did do, the other states did, is that the tobacco money that came in, they actually use it mostly for health related
Right,
issues.
sure.
They did, that's as opposed to, toll roads or whatever.
That was,
The other
As
states
opposed
did.
to the
The
general
Indiana
fund.
plan
Yeah.
one was.
Yeah, there are plenty of
tobacco
other
money.
states used it to do other things, but Indiana actually used that money for health related things. So I'm proud of them for doing that. Thank you for
Well,
presenting that.
They,
Yeah,
that money, I think, with the settlement, it was required to be earmarked for something health related. Couldn't just go. in-
Theoretically, but that's not what happened, was it?
Mm.
Yeah, anyway, that's the nice thing in theory it was supposed to happen, but anyway, that didn't, some states did better than others.
Yeah, it was nice-
Indiana did well
nice
with
that you
it.
summarized that, Mark.
Yeah, you're welcome.
Thank you, appreciate
Yeah.
it. So that was the last thing on our agenda. Anybody else have anything else to say? Add? We have our next meeting, which is October 13th. Same place,
And I will not
Same
be here
place?
for that.
October 13th?
Yeah.
October 13th, is what's on my calendar.
Okay.
Okay, sounds good.
I think I wrote it down, but I'm not.
We need a
sure.
motion to adjourn.
So moved.
Need a second? Okay, I don't think anyone's gonna complain. All right, I'm not voting on that.
Texting you a ride.
I'm just telling him on my way. He has work to do.
You have a long way to drive,
I just driving Lexington today.
but that's pretty far away. That's down near my hometown.